Physical therapy is a healthcare profession which aims to enhance and restore functional ability and quality of life to those with physical impairments or disabilities. Physical therapists, or physiotherapists, are primary healthcare professionals who diagnose and treat individuals of all ages, from newborns to the very oldest, who have medical problems or other health-related conditions, illnesses, or injuries that limit their abilities to move and perform functional activities as well as they would like in their daily lives. Physical therapists examine each individual and develop a plan using treatment techniques to promote the ability to move, reduce pain, restore function, and prevent disability. In addition, PTs work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyles, providing services to individuals and populations to develop, maintain and restore maximum movement and functional ability throughout the lifespan. This includes providing services in circumstances where movement and function are threatened by aging, injury, disease or environmental factors. Functional movement is central to what it means to be healthy. Physical therapy is concerned with identifying and maximizing quality of life and movement potential within the spheres of promotion, prevention, treatment/intervention, habilitation and rehabilitation. This encompasses physical, psychological, emotional, and social well-being. Physical therapy involves the interaction between physical therapist, patients/clients, other health professionals, families, caregivers, and communities in a process where movement potential is assessed and goals are agreed upon, using knowledge and skills unique to physical therapists. Physical therapy is performed by a physical therapist, PT, or physiotherapist, and sometimes services are provided by an assistant, PT, acting under their direction. PTs use an individual's history and physical examination to arrive at a diagnosis and establish a management plan and, when necessary, incorporate the results of laboratory and imaging studies, electrodiagnostic testing, electromyograms and nerve conduction velocity testing, may also be of assistance. PT management commonly includes prescription of or assistance with specific exercises, manual therapy, education, manual therapy, manipulation and other interventions. Physical therapy has many specialties including cardiopulmonary, geriatrics, neurologic, orthopedic and pediatrics, to name some of the more common areas. PTs practice in many settings, such as outpatient clinics or offices, inpatient rehabilitation facilities, skilled nursing facilities, extended care facilities, private homes, education and research centers, schools, hospices, industrial workplaces or other occupational environments, fitness centers and sports training facilities. Cardiovascular and pulmonary rehabilitation. Physical therapists treat a wide variety of individuals with cardiopulmonary disorders or those who have had cardiac or pulmonary surgery. Primary goals of this specialty include increasing endurance and functional independence. Manual therapy is used in this field to assist in clearing lung secretions experienced with cystic fibrosis. Disorders, including heart attacks, post-coronary bypass surgery, chronic obstructive pulmonary disease, and pulmonary fibrosis. Treatments can benefit from cardiovascular and pulmonary specialized physical therapists. This specialty area encompasses electrotherapy/physical agents, electrophysiological evaluation, EM/NCV, physical agents, and wound management. Geriatric physical therapy covers a wide area of issues concerning people as they go through normal adult aging but is usually focused on the older adult. There are many conditions that affect many people as they grow older and include but are not limited to the following: arthritis, osteoporosis, cancer, Alzheimer's disease, hip and joint replacement, balance disorders, incontinence, etc. Geriatric physical therapists specialize in treating older adults. Integumentary, treatment of conditions involving the skin and related organs. Common conditions managed include wounds and burns. Physical therapists utilize surgical instruments, mechanical lavage, dressings and topical agents to deride necrotic tissue and promote tissue healing. Other commonly used interventions include exercise, edema control, splinting, and compression garments. Neurological physical therapy is a field focused on working with individuals who have a neurological disorder or disease. These include Alzheimer's disease, Charcot-Marie-Tooth disease, CMT, brain injury, cerebral palsy, multiple sclerosis, Parkinson's disease, spinal cord injury, and stroke. Common impairments associated with neurologic conditions include impairments of vision, balance, ambulation, activities of daily living, movement, muscle strength and loss of functional independence. Orthopedic physical therapists diagnose, manage, and treat disorders and injuries of the musculoskeletal system including rehabilitation after orthopedic surgery. This specialty of physical therapy is most often found in the outpatient clinical setting. Orthopedic therapists are trained in a treatment of post-operative orthopedic procedures, fractures, acute sports injuries, arthritis, sprains, strains, back and neck pain, spinal conditions and amputations. Welcome back to life. A single chance to love again. Forget something in return. It's love never minds. We'll come back to life. Accept being get hip and go at the behest of love. Open your soul to be closed. Somebody an album idol like that anvil. Pediatric physical therapy assists in early detection of health problems and uses a wide variety of modalities to treat disorders in the pediatric population. These therapists are specialized in the diagnosis, treatment, and management of infants, children, and adolescents with a variety of congenital, developmental, neuromuscular, skeletal, or acquired disorders/diseases. Treatments focus on improving growth and fine motor skills, balance and coordination, strength and endurance, as well as cognitive and sensory processing/integration. Children with developmental delays, cerebral palsy, spina bifida, or torticollis may be treated by pediatric physical therapists. Welcome back to life. See yourself standing right beside Tito. You need withstand tears, wear a new smile, and survive on sad eyes. Physical therapists are involved in the care of athletes from recreational to professional and Olympians. This area of practice includes athletic injury management, including acute care, treatment and rehabilitation, prevention, and education. Women's health physical therapy addresses women's issues related to childbirth and postpartum. These conditions include lymphedema, osteoporosis, pelvic pain, prenatal and postpartum periods, and urinary falling out of lovers is the renewing of love within to find treasure trove.